Hey everyone, I'm Dr. Kirsten, vet here at ManyPets, and in this video, we are going to talk to you about something known in the vet world as BOAS, and that stands for Brachycephalic Obstructive Airway Syndrome. This is a common issue for our flat-faced breeds, including French Bulldogs, English Bulldogs, Pugs, and Boxers, to give a few examples. So what does brachycephalic mean? This term is going to refer to our more flat-faced breeds. We're talking about those animals who have a more prominent lower jaw, and the upper jaw and the nose are pushed back. This is going to cause abnormalities of the airways and make it harder for these pets to breathe. There's a group of changes that we're talking about when it comes to anatomy of a brachycephalic pet, and these are going to include the following. The first is a term called stenotic nares, which is also the fancy way to describe narrowed or smaller nostrils. The next change is going to be something that we call everted laryngeal saccules. We're talking about two pieces of tissue that normally are tucked up really nicely and out of the way at the back of the throat, but in dogs with BOAS, those are going to be out and potentially blocking airflow at the back of the throat. Next is going to be an elongated soft palate. So at the back of the throat, there's going to be tissue that comes close to where your airways and your digestive tract meet. Now, dogs that have BOAS are going to have more soft tissue back there, which potentially can get in the way and block airflow. Lastly is going to be what we refer to as hypoplastic trachea, which also just means a small or narrowed trachea. That's our main airway that goes through the chest, and when that is smaller, it makes it much harder for our pets to breathe. Unfortunately, all of our brachycephalic breeds are going to be affected by this syndrome to some degree. For the lucky ones, it can be mild, but in more severe cases, we may need to talk about surgical intervention. Here are some signs your pet may require medical attention. First, excessive snoring, including snoring sounds when they're awake. This can even carry on further into something as progressive as sleep apnea, where they actually have periods of time where they stop breathing when they're sleeping. You may notice noisy or low-pitched breathing coming from the nasal passages and upper airways. We might call this stertor. Exercise intolerance is going to be another common issue, including trouble during activity, but also prolonged recovery after activity. Brachycephalic pets are also going to have a harder time with warmer temperatures. Pets with BOAS may also be predisposed to regurgitating or vomiting more frequently because of their abnormal airways. And in some severe cases, patients may even overdo it enough to experience episodes of collapse. We've talked about some of our more commonly recognized brachycephalic breeds, such as Bulldogs and Boxers, but we have to remember that there's a large number of breeds that can be classified as brachycephalic, including Shih Tzus, King Charles Cavaliers, and some Chow Chows. We also have to remember that brachycephalic is just not restricted to dogs. We can also see brachycephalic cat breeds, including Persians, Himalayans, and exotic Shorthairs. If you're worried your pet is being affected by symptoms of BOAS, it's important to talk to your vet. Diagnosis is usually going to be based on physical exam, history, and listening to your pet's breathing. In some cases, we may want to do a sedated or fully anesthetized examination so we can properly look at the airway. If we feel like BOAS is significantly affecting your pet's quality of life and ability to breathe, surgery may be an option. The two most common corrective procedures that you're going to see in pets with BOAS is going to be widening of the nasal passages or the nares and decreasing the length of the soft palate. By addressing both of these, we can decrease the resistance of air going through the airways and make it a little bit easier for these pets to breathe. Surgery doesn't cure your pet of brachycephalic airway syndrome, but it can improve clinical signs significantly. However, surgery for these patients can easily get up into the several thousand-pound range, dollars if you're in the US, so it's important to keep these factors in mind when we're discussing brachycephalic breeds. With a brachycephalic breed, it's important to stay proactive about their health. So here's some important tips to remember. Keep your pet at a healthy weight to avoid extra pressure on their airways. Avoid outdoor activity when temperatures are getting warmer. We know that pets with BOAS will have a harder time in warmer temperatures and a harder time recovering from warmer temperatures. We need to keep in mind that these pets are also going to have a slightly increased anesthetic risk. That doesn't mean that they can't safely undergo anesthesia, but it's a conversation worth having with your vet when it comes time. Know that your pet may experience regurgitation or vomiting more frequently than other breeds, and if you want more information, check out our video about vomiting in pets. Finally, if you're thinking about bringing home a brachycephalic breed, keep in mind the things that we've talked about in this video. Over time, the features of brachycephalic obstructive airway syndrome have become more pronounced and are making a massive impact on these pets' health. Brachycephalic breeds can be very loyal and loving companions and make great pets, but it's important that we promote responsible breeding and healthy dogs to continue to enjoy these as pets over time. Thanks for listening. I hope this video has been helpful.